Hello and welcome to our channel. Today we're discussing an important topic for all expecting mothers: the top 10 foods to avoid during pregnancy. Pregnancy is a crucial time when the mother's diet directly impacts the health and development of the baby. While a balanced diet is essential, there are certain foods that pregnant women should avoid to ensure a healthy pregnancy. If you found this video helpful, please give it a thumbs up and subscribe to my channel for more health tips and informative content like this. 1. High mercury fish. High mercury fish should be avoided during pregnancy due to the potential harm mercury can cause to the developing baby's nervous system. Mercury is a toxic metal that can accumulate in fish, particularly large predatory fish, as they consume smaller fish containing mercury. Fish that are high in mercury include shark, swordfish, king mackerel, and tilefish. These fish should be avoided during pregnancy, as well as while breastfeeding, to reduce the risk of mercury exposure to the baby. Instead, pregnant women can safely consume a variety of low-mercury fish, such as salmon, shrimp, pollock, and catfish. These fish are not only lower in mercury but also provide important nutrients like omega-3 fatty acids, which are beneficial for the baby's development. It's important to note that fish is a valuable source of protein and other nutrients essential for pregnancy. However, pregnant women should be mindful of their fish choices and opt for low-mercury options to ensure a safe and healthy pregnancy. 2. Undercooked or raw meat. Undercooked or raw meat should be avoided during pregnancy due to the risk of foodborne illnesses. Raw or undercooked meat can harbor harmful bacteria such as Salmonella, E. coli, and Listeria, which can pose serious health risks for both the mother and the baby. To reduce the risk of foodborne illnesses, it is important to cook meat thoroughly. Use a food thermometer to ensure that meat reaches a safe internal temperature. For beef, pork, veal, and lamb, this is typically 145 degrees F, 62.8 degrees Celsius, with a 3-minute rest time. Ground meat should be cooked to 160 degrees F, 71.1 degrees Celsius, and poultry should be cooked to 165 degrees Fahr, 73.9 degrees Celsius. Avoid consuming raw or undercooked meats, including dishes like steak tartare, sushi, and rare or undercooked burgers. It is also important to practice proper food handling and hygiene, such as washing hands and surfaces that come into contact with raw meat, to prevent cross-contamination. Following these guidelines can help ensure a safe and healthy pregnancy. 3. Processed and deli meats. Processed and deli meats should be consumed with caution during pregnancy. These meats may be contaminated with Listeria, a bacteria that can cause food poisoning. Pregnant women are at a higher risk of Listeria infection, which can lead to serious complications including miscarriage, stillbirth, or infections in the newborn. To reduce the risk of Listeria infection, it is recommended to heat deli meats and hot dogs until they are steaming hot before consuming them. This can help kill any bacteria that may be present. It's also important to store deli meats properly, refrigerating them promptly and consuming them before the expiration date. Alternatively, pregnant women can choose to avoid deli meats and opt for safer protein sources such as cooked poultry, fish, or plant-based proteins. By taking these precautions, pregnant women can help ensure a healthy pregnancy for themselves and their babies. 4. Raw eggs. Raw eggs or foods containing raw eggs should be avoided during pregnancy. Raw eggs can carry harmful bacteria such as Salmonella, which can cause food poisoning. To reduce the risk of Salmonella infection, it's important to cook eggs thoroughly until both the yolk and white are firm. Avoid foods that contain raw or undercooked eggs, such as homemade mayonnaise, Caesar salad dressing, and some desserts like mousse or tiramisu. Opt for commercially pasteurized egg products in recipes that call for raw eggs, or choose cooked alternatives. Proper food safety practices, including washing hands and surfaces that come into contact with raw eggs, can further reduce the risk of infection. 5. Alcohol. Alcohol should be avoided during pregnancy as it can cause serious harm to the developing baby. When a pregnant woman drinks alcohol, it passes through the placenta to the baby, potentially leading to a range of health issues known as fetal alcohol spectrum disorders, FASDs. These can include physical, behavioral, and intellectual disabilities that can last a lifetime. There is no known safe amount of alcohol that can be consumed during pregnancy, so it's best to avoid it altogether. This includes all types of alcohol, such as beer, wine, and spirits. If you have consumed alcohol early in your pregnancy and are concerned, it's important to talk to your healthcare provider. They can provide guidance and monitor your pregnancy to ensure the best possible outcomes for you and your baby. 6. Unwashed produce. Pregnant women should wash fruits and vegetables thoroughly before eating them to remove dirt, bacteria, and pesticides. Consuming unwashed produce can increase the risk of foodborne illnesses, which can be especially harmful during pregnancy. To wash produce, use clean running water and gently rub the surface of fruits and vegetables with your hands or a brush. Dry produce with a clean cloth or paper towel after washing. It's important to wash all types of produce, including those with skins or rinds that are not eaten, as bacteria can transfer from the surface to the inside when cut or peeled. If possible, choose organic produce or wash conventionally grown produce with a fruit and vegetable wash to reduce pesticide residues. By practicing proper food safety measures, pregnant women can reduce the risk of foodborne illnesses and ensure a healthy pregnancy. 7. Caffeine. During pregnancy, it's important to limit caffeine intake as excessive consumption has been associated with adverse pregnancy outcomes. While moderate caffeine intake is generally considered safe, it's advised to limit daily consumption to 200 milligrams or less. This is roughly equivalent to one 12-ounce cup of coffee. High levels of caffeine can lead to issues such as low birth weight, miscarriage, and preterm birth. Caffeine is also a stimulant that can interfere with sleep, which is crucial for both the mother and the baby's health. To reduce caffeine intake, consider switching to decaffeinated coffee or tea, or choosing caffeine-free beverages. Be mindful of other sources of caffeine, such as soda and chocolate, and check labels for caffeine content. It's always best to consult with a healthcare provider for personalized advice regarding caffeine consumption during pregnancy. 8. Excessively sugary and fatty foods. During pregnancy, it's important to limit consumption of excessively sugary and fatty foods. While some amount of sugar and fat is necessary for a healthy diet, consuming too much can lead to excessive weight gain, which can increase the risk of gestational diabetes and other complications. Instead, focus on eating a balanced diet rich in fruits, vegetables, whole grains, and lean proteins. These foods provide essential nutrients for both you and your baby without the added sugars and unhealthy fats. Remember, moderation is key, and it's okay to indulge in treats occasionally as long as they are part of an overall healthy diet. 9. Raw sprouts. Raw sprouts, such as alfalfa, clover, and radish sprouts, should be avoided during pregnancy due to the risk of bacterial contamination. Sprouts are grown in warm and humid conditions, which are ideal for bacteria growth, including Salmonella, E. coli, and Listeria. These bacteria can be difficult to wash off sprouts, and consuming raw sprouts can lead to foodborne illnesses, which can be especially harmful during pregnancy. To reduce the risk of foodborne illnesses, it is recommended to cook sprouts thoroughly before consuming them. Cooking sprouts can help kill any bacteria that may be present. Alternatively, pregnant women can choose to avoid raw sprouts and opt for other vegetables that can be safely consumed raw or cooked. It's important to practice proper food safety measures to ensure a healthy pregnancy. 10. Deli meats and hot dogs. Deli meats and hot dogs should be avoided during pregnancy unless they are heated until steaming hot. These products can be contaminated with Listeria, a bacteria that can cause foodborne illnesses. Pregnant women are more susceptible to Listeria infection, which can lead to serious complications including miscarriage, stillbirth, or infections in the newborn. To reduce the risk of Listeria infection, it is important to heat deli meats and hot dogs until they are steaming hot before consuming them. This can help kill any bacteria that may be present. It's also important to store deli meats properly, refrigerating them promptly and consuming them before the expiration date. Alternatively, pregnant women can choose to avoid deli meats and hot dogs and opt for safer protein sources such as cooked poultry, fish, or plant-based proteins. By taking these precautions, pregnant women can help ensure a healthy pregnancy for themselves and their babies. It's essential for pregnant women to be mindful of their diet and avoid these 10 foods to ensure a healthy pregnancy. Consult with your healthcare provider for personalized dietary advice during pregnancy. Thank you for watching, and we hope you found this video helpful. Don't forget to like, share, and subscribe for more health tips.